start our July 20th meeting of our Health Services Committee. Can I first of all get a motion to approve the minutes of our prior committee meeting? Supervisor Beatty, second by Edna Frazier. All those in favor?
Aye.
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 Rob, you're in the house. Welcome. We looking at your action agenda. Our first resolution is to amend resolution 558 of 2019 to remove citizen advocates and to replace it with Behavioral Health Services North. Can I first of all get a motion to get this on the floor and the second, and then Rob can explain the pros and the cons. So Supervisor McGowan, second by Supervisor Scheffler. All those in favor?
Aye.
Thank you very much. Rob, go for it.
Okay, so thank you, everyone. Good morning. I do have this resolution request. I think as folks are aware, we had been looking to find an agency that could take over some of the outpatient services of the Glens Falls Hospital, both their mental health and substance abuse outpatient services and their family support program for mental health. We had been working with an agency by the name of Citizen Advocates. Several months ago, they pulled out of the discussions and process, and we identified another agency that we had been working with. Actually, we had been talking with them at the time that we selected Citizens, and when Citizens pulled out, Behavioral Health Services North was still interested, and so now we are working with them to take over those services. So that's the reason for the request, and we anticipate that they will be taking over at some point later this year, probably September or October. So that's why the amount is reduced, and we look forward to working with them. They seem like good partners so far.
Thank you, Rob. Does anyone have any comments, concerns, questions, observations? Yes, Dan, did I see your hand up or not? No.
Yes, I have one up. Thank you.
Okay, Brad, go ahead. Yeah.
Thank you, Mr. Chairman. Yes, Rob, thanks. Now, I see a big difference, and that's because it's coming into a partial year.
Yes, we thought with Citizens, we had that amount listed at $396.86 because we thought they were taking over earlier in the year.
All right, now, and then, so now that we're getting in, I mean, will the contract being reduced, I know it's 100% state aid, but I was just wondering, you know, do you feel that there'll be that cheap for the rest of the contract or future contracts, or?
So what that is that amount represents a prorated amount for the balance of the year. So next year, 2021, it would be a full year contract, and not sure if I have that number in front of me, but it would be a full year contract. So this represents, I think, 4 months worth of the contract.
All right, so it'll probably balance out to be about the same then, or a
Yes.
little more?
Yeah, we just passed through the state aid that's available.
Okay, thank you.
Yep.
Any further questions by anyone? Seeing none, all those in favor?
Aye.
Say aye. Approved. The number 4, Rob, 2020 year-to-date forensic expense report. Help us with that.
Yep, so in your packet, I did provide a year-to-date report on these are the chargeback expenses. I reported on these committee meeting earlier this year. You know, there's been a shift. It used to be a cost to the county 50%, and the state paid 50% of the chargeback expense. But now it'll be 100%. So I wanted to keep the committee apprised as we go through the year where we are. So just to refresh memory for a minute, these expenses under the CPL 730, this Criminal Procedure Law 730, we receive an order from the court to have two psychiatric examiners perform the examination. That is a charge to the county. We pay $150 per examiner for the examinations. And sometimes there's no shows. Sometimes there's a little bit more for travel if they have to go to court to testify, etc. So far for the year, we budgeted at $40,000. On the examinations themselves, we've had 12 examinations at an expense of $2,613. And then on the chargeback expense itself, this is what we get charged back from the state when a felony level defendant is found to be not competent to stand trial. They go to a state hospital and there's a charge to the county. Now, these charges were at the 50% level because they occurred in January. You can see the dates. So we had one defendant in this year from January 1st to January 20th. And that expense was at $12,778. So our total expenses for the year are those chargeback expenses plus the examinations so total of $15,391, and it leaves us with a balance of $24,609. So at this point in the year, we're at 38.5% of budget. But again, these, if you get somebody who gets hospitalized, the expenses add up very quickly and will add up even quicker now that we're paying 100%. So information only.
Thank you, Rob. And I think if my memory serves me correctly, in past years, these are court ordered. So a judge basically makes the order, and you carry it out. So the difficulty of maybe predicting or precisely defining what the amount of money will be in a budget can be difficult, but it appears as if it's under control.
Yes.
Any other comments or questions on this particular item? Seeing none, number 2, third quarter state aid advance. Rob.
Okay, so yes, I wanted to, we also have a handout in the packet that shows our third quarter state aid advance withholds. Both OMH, Office of Mental Health, and OASIS, the Office of Addiction Services and Supports, have instituted a third quarter withhold as a cash flow management strategy for the state. And so the OMH is withholding approximately 20% on our third quarter advance, and OASIS, their withhold came in close to 31%, although they are recalculating that because they felt it was higher than they had anticipated. So they think they're going to reduce that and issue a supplemental payment. They are calling this just a withhold at this point. They're hoping that later in the quarter, federal stimulus would come through that would allow them to make the advances whole. We are having discussions though with our agencies to plan for management of this withhold and also to plan for contingency, if this funding is not restored.
Thank you. Supervisor Beatty, did you have a question, Doug?
Yeah, thank you. Thanks, Chairman. How many dollars is this, Rob?
So
this withholding?
Yep. So the withhold for the Office of Mental Health is $147,057. So $147,057, and then the amount for OASIS is $73,267.
So about 220,000 roughly, approximately. I'm just calling it about 220. And the state held back on the last thing you also were talking about. I don't have it right in front of me. 20% on something else before this item you were talking about. So how many dollars was that?
Could you say that again? I'm sorry, I missed it.
I apologize. I don't have my agenda in front of me. For some reason, it didn't come in. So, you were talking about before these two particular 20%, 31% holdbacks. you're talking about something else that the state was cutting us 20% or 50%. We are going to fund now 100% of court mandated or ordered cases in which the defendant had to go to certain facilities, correct?
Correct. Yeah,
So what dollar amount do you anticipate that? And I know it's a guess because who knows how many people are going to be reprimanded to a facility. But how many dollars was it last year? I guess maybe that would give me a little indication. I know it's a spitball, but that would give me a little indication how many dollars we're thinking.
Yeah, so I don't have those numbers right in front of me. I mean, we do have those numbers, so I can look them up. I could even give you basically like a 5-year look back, 4 or 5 year look back.
I'd like that. I appreciate that. Thank you. That'd be helpful.
Yeah. It would give you a ballpark if you looked at the 4 to 5 year look back and then just double what the expenses were.
Yeah, that'd be appreciated. Thank you.
Yep.
Thank you, Rob. If you can do that and maybe email committee members, that would be helpful, okay? Thank you very much. Number 3, the transition of outpatient behavioral health services.
Yep. So again, just informational. I just want to let everyone know that we are continuing to work with this, with a new agency, Behavioral Health Services North. They are bringing a lot of energy to the project, very excited about the opportunity to come into our community and assist us with these services. They're a successful provider in the North Country, several counties in the North Country, and things are progressing well. We haven't really run into any snags, knock on wood, and we're looking forward to a time frame of sometime this fall, transition those services.
Thank you very much. And any other questions or comments from any committee members? That being said, we thank you very much, Rob. Okay, you have a good day.
Yes, thank you. You too.
Janelle, basically, you continue to make the news, front page this morning. Congratulations. So, your first resolution is to authorize a contract with a speech language pathologist to provide speech therapy services for home care and preschool programs. Can I just get a motion to put it on the floor in a second, and then before Janelle gets into it, can I get a motion to do that? Susan Shepler, seconded by Supervisor Conover. All those in favor? Aye. Janelle, yep.
The justification for this resolution request is we continue to need speech therapy providers to serve our department's pediatric and adult population. The agency must have the capacity to accept referrals and provide these services, and these therapy services are billable and revenue generating.
Thank you. Does anyone have any questions? Pertinent? Seeing none. All those in favor? Aye. Aye.
Aye.
Thank you. Request number 2 for the transfer of funds. Tawn, is Tawn going to jump into that?
Yep.
Now? Okay. Thank you.
Okay, attachment number 6 regarding the transfer of funds. The first one is primarily we have an employee who works in 2 different departments. She does some of her job, and we need to transfer some of the fringe benefits for hospitalization and dental from one program to the other. So I'm moving $5,120. The second one is a similar situation that I have an employee who health benefits and dental change during the year. So again, I have to move some money. I'm taking it out of part-time salaries to move to cover these expenses. That totals $5,100. I'm hoping these funds will cover us till the end of the year, but I'll be analyzing it monthly. And my third one is our big one. We have the second COVID grant, which was, I believe, $95,383. And when we first initiated it and put the funds in, we didn't know where we were going to spend it. We're finding that a large part of it right now is we are having difficulty getting our gowns and our masks and we need to order those as much as we can when we can. So I did an analysis. I'm moving from our full-time salaries and some of the overtime salaries in there where I initially put them over into our part-time salaries, where Janelle has been able to hire temporary people to help us out with the tracing, with the testing and everything. And also, I need to move funds over to medical supplies, obviously, to pay for these. So I'm moving a total of $36,225 out of basically salaries and some fringe over to part-time salaries and medical supplies to cover this. I'm moving $14,725 into medical supplies, and at this point, that should cover what we're doing right now, but I'm sure I'll be back to ask for more if we need to move money, but that's the biggest one that I'm moving for. So those are the three that I have, total $46,445.
Thank you, Tom. Can I get a motion to get that on the floor? Brad McGowan with the motion, Supervisor Shepler with a second. Any further discussion? All those in favor?
Aye.
All in favor. Thank you. Janelle, any further comments, additions, deletions?
So we don't have any pending items at this time. So moving on to information for discussion and review, I'll turn it back over to Ton to review our attachments 1 and 2.
Okay, attachment 1 is our current status of financials. As of July 13th is when I printed all this information. Was before, it was as of July 7th payroll and July 5th of this year. You will see with our salaries again, due to COVID, we haven't used a lot of our clinical nurses because all our clinics are shut down. Within these numbers, however, are our COVID numbers, and we still right now are 65,438 below where we were this time last year. To note, we're 42.14% of the current budget, and last year at this time we were 51.08% of the budget. Attachment number 2, comparing again last year to this year, you can again see the salaries, what that difference was, which I just noted. Equipment, again, is just bottom line, a car, that additional car, which due to COVID, our third car that's due, we are told we probably won't get until August at this point. It was due in June. Contractual services, again, we're down. Again, it's due to our preschool and our early intervention. As you know, with the COVID, a lot were trying to be seen by telemonitor, but a lot weren't, and we're just waiting for those. The other thing, too, to note is that our expenses are down, too, because one thing is, obviously, if the kids aren't in school, the transportation issue. The buses, we're not paying for that transportation at this point, so those expenses will not be reflected, and therefore revenue down the road will not be either. Employee benefits, it's up a little bit, slightly, and it's due to increase in what's happened with health. And like I just said, I had someone who added health insurance, and that can just make a change, just having one person. Bottom line with the revenues, we are down. What I did notice is last year at this time, we had our preschool. The first AVL that we submit is usually in by now, but it hasn't been submitted. But when I talked to my billing person who does that, she estimated we're anticipating about $450,000 or more we'll be getting, and that will be booked for the preschool program, and then it will be consistent with last year. But right now, I actually got to say, I think probably within an hour after I finished these, the state did release that we can now submit those to the state for payment. So that hasn't been submitted, but now it can be, so we'll be seeing that hopefully within the next couple months, I hope.
Thank
and
you,
that's
Tom.
all I have.
Thank you, Thornburg. Any questions for Tom? Seeing none. Janelle, continue on.
All right, moving on to attachment 3. This is our status of referrals. Looking at that, we're still kind of seeing the lag due to some of the COVID activity and the decrease or drop of referrals. When we did get some referrals, some of the patients didn't want to be seen because of their fear for COVID. But in June, we did start to see an uptick. If you look down at the bottom with the revisits, we're actually up from April to May with the revisits. We certainly anticipate that for June and July, we're in that same boat. A lot of our patients now, with the continuity of care and the fact that they're needing additional visits, you know, versus maybe an admit discharge or an admit and see you a couple times. You know, we've got some wound cares and things that need follow-up visits. So we are seeing a greater number of revisits, which is good. And then a report that Mr. Driscoll had asked for was a breakdown by towns. And so that's the second part of that attachment, so you can see where the majority of our cases are for our home care. Attachment 4, oh, I'm sorry, are there any questions? Attachment 4 is our emergency preparedness activity sheet for your review. Attachment 5 is our rabies report for our rabies program. Even despite COVID, we're still busy with rabies. We actually had 21 bites in July so far. We've tested 6 rabies specimens in July. We actually had 1 come back positive. We've made 4 post-exposure approvals. Unfortunately, we don't have any rabies clinics scheduled. We're hoping to start our rabies clinics back in September, at least monthly, because we do realize that there are animals that need to be vaccinated, because we certainly don't want rabies in the county either. Right now, we've been taking hardship cases case by case and working with the vet and providing them the vaccine to administer the vaccine. So if there is a significant need and somebody that is unable to afford a rabies vaccine through the vet, we're happy to try to help them. They can contact our office. So I believe that goes through our attachments. We're on to, I don't have any meeting authorizations because everything's being done by Zoom right now. And jumping on to a COVID update, we have right now 8 precautionary quarantines. We have 81 travelers. We're still encouraging, well, we're discouraging travel to other states. We're discouraging people coming from other states, but if people do come or have had to travel to the states of concern, we're encouraging people to call us just so we can put them in a precautionary quarantine, which we call our travel quarantine list, so that we're able to check in. We don't want to just tell somebody you have to quarantine for 14 days. We really want to check in with them daily to make sure they're not getting symptoms. So if they do, we can take the appropriate actions. We can offer them testing. We can help them find medical care if they need it, kind of thing. Our mandatory quarantines are up to 30 with 23 actual addresses that we go to visit. Happy to say we don't have any hospitalizations right now. Our lab confirmed cases, we have 267. Of those, 117 have been in nursing homes, 12 have been in assisted livings, and 138 have been in the community. Right now, of our cases, 9 are mildly ill, and 225 have recovered, and sadly, we've lost the 33 that have made the ultimate price for this COVID pandemic. Over the weekend, we got a new certificate from the Johns Hopkins Contact Tracing Program, so we're up to 82 certificates for that. We have a very robust group of people that are willing to help us should we need to reach out. And I think through all of this, I just can't say enough how much I appreciate the team effort, the support from other departments, from the board, from the administration, from our own department, from the community. It's just really appreciated. This weekend especially, we really overused the county attorney's office. Thank you, Ryan Dickey, for all your help and being there for us both Friday night, Saturday, Sunday, and actually going back to Thursday night as well. And we also thank the Sheriff's Department. They've been with us. They did a lot of visits with us over the weekend because we had a few issues that we ended up working out nice and civilly. Just to note, what we're seeing are new trends and new challenges with this COVID epidemic. The gatherings, they're allowed, but I still strongly discourage, people to go to those. If people must go to gatherings, I very, very, very much suggest and require and request, whatever I'm allowed to do in my capacity, that social distancing is maintained in compliance with the governor's order and public health recommendation, staying 6 feet away. I'd even propose staying 10 feet away, because a lot of people 6 feet away is probably 2 feet away. We really need to look at that 6 feet and probably make it 10 for good measure. That is essential. Eating and drinking, obviously you can't do that with a mask. People really need to be sitting with their own household people. They again need to be socially distanced when they are unable to wear a mask as well. So gatherings, we're starting to see from our July 4th celebrations, some birthday celebrations, we're starting to see cases pop up from that. And it's not just cases from exposures to those parties. Those are cases that spill into people's work and into their friend and family circles. So it's very dangerous. So we need to be vigilant and, really discourage the gatherings. But if people go, they need to be very, very careful. I'm hearing when we're doing the investigations that people aren't wearing masks at these gatherings, and that's very concerning to me and my department. Another trend that we're seeing is with sports and travel sports. I know there's a lot of money invested in that. I know there's a lot of opportunity for college coaches to see, these players at tournaments. It's sad. It's a sacrifice that everybody needs to pay, but we really need people not to be traveling. Right now, the governor's order says that they have to be in the capital region or within their region, and the contiguous counties, they should not be traveling to other states. We really need, as a community, to support this and encourage this. And when we see people traveling, hear people traveling, we really need to discourage that or report that to the New York Complaint Hotline, which is 833-789-0470. I'll repeat that again. It's 833-789-0470. When we do hear about sports travel, I am strongly encouraging anybody that has traveled in the last 14 days for sports to contact me or our department so that we can kind of go over and review any kind of special precautions. And I certainly am encouraging and asking for support that when we have to reach out to coaches on these travel teams, that they be upfront, they be honest, they be informative, they give us the information we need so we can quickly act on this. My concern is this is youth. Youth are hard to corral. They're hard to keep home. If they follow the rules ahead of time, they don't have to stay home. But if they're going to travel, they need to be quarantined when they get back. You're talking, if you have 11 people on one team, 11 people on another team, you're looking at 22 individuals, of which are from several different areas and places that potentially could be at risk of spreading this. It's very hard to do these contact investigations to control the disease. So we need people to stay home and not go on these trips. If they're going to go on these trips, we need them calling public health so they can be quarantined when they get back. And that's a fact. And we need coaches to cooperate and give us this information. We have had a very difficult time with this last team that we've been working with, and it's very disappointing to know that there might be the boys lacrosse team traveling, the baseball teams traveling, softball teams traveling, and whatever other spring sports or summer sports are traveling right now. We really need to stick and adhere to the governor's order. And I'm planning on doing all the enforcement I can through my office. And I'm just looking for people's cooperation from the community level, from my department level, from the other departments, as we have been a good team, and probably from yours if things escalate to the board level. I think that's all I have. If anybody else has questions, I'm available.
Any questions for Janelle from any board members? I see none, but as a board member, I appreciated your comments in this morning's newspaper. We all in our own way have got to just do the right thing. And we understand the frustration of sports teams, but we all have to play by the rules. And that's the way we're all going to get on track. So again, I appreciated your comments in this morning's paper, Janelle. Any further? Go ahead, Ryan. Yeah.
Can I supplement that, please? With respect to the sports travel, there's been a lot of innuendo that the rules are confusing, the rules change all the time, the rules are inconsistent. No, they're not confusing. They haven't changed. They've been consistent. You can't travel outside of the capital region and the contiguous counties. And let me list those counties so that everybody knows what they are. We'd appreciate help from the media, and we've gotten that. I thank them so far. We'd appreciate more. The counties in the capital region working our way down are Warren, Washington, Saratoga, Schenectady, Albany, Rensselaer, Greene, and Columbia. The contiguous counties, again, working our way up and around and down, Essex, Hamilton, Fulton, Montgomery, Schoharie, Delaware, Ulster, and Dutchess. There's nothing confusing about that. Those are the only places where we can host teams from. If you're from outside that area, you shouldn't be coming here playing a tournament. And if you're from this area, you shouldn't be leaving those 16 counties. Doesn't mean you go to New Jersey. Doesn't mean you go to Vermont, go to Connecticut. It doesn't mean you go on the beach while you're in Connecticut, which we saw this morning from one team posting where they had been. It means you stay in those 16 counties. And if you don't, there's consequences to that.
Thank you, Ryan. Any further comments from any committee members? Seeing none, can I get a motion to adjourn? Edna Fraser, seconded by Supervisor Bruno. All those in favor? Aye. Thank you very much. Meeting adjourned. Thank you.